Okay, we start again. So, likewise, these illnesses today which were incurable, you ask some senior person that what about tuberculosis? They say if someone has tuberculosis, well, he is finished. He is finished. Great people of our classical singers were Likar Sahab, like Kumar Gandharva and Bal Gandharva. If you heard those singers, they used to get chest infections, pneumonia, tuberculosis, and also die because of there was no good health care. So it was pretty common for people to die at the age of 50, 55, 45, 50. But today, because, as I said, good centers like Health Library, good centers which provide a lot of healthcare information and good doctors, some credit to us also, we have been able to tackle these demons. And that's the reason why our geriatric population is quietly growing and growing. At the same time, the birth rate also is not coming under control. So overall population, you see, is growing. Good or bad, I do not know. We are talking here about the demographics. So the WHO forecasts that it will reach 2 billion by 2050. It reflects improving global health, but it poses special challenges to the 21st century healthcare providers, because the onus ultimately comes on the healthcare providers to give good treatment to these elderly people. Now, due to low mortality, means low death rate, and increased life expectancy, world's population is aging, but it is unfortunate that there are less healthcare facilities. There are a lot of old age homes and a lot of institutions, because they want to show philanthropy, they go to old age homes and give aid. But try to understand, even the person in your family, your father is also aging. Are you giving him adequate health care? Are you giving him time? Forget, we'll come to that later on. Your uncle is aging. Your old grandmother is 85, she needs attention and she has got a lot of problems. Her digestive system is working at 50% of what your digestion is working. But are we taking some special aid to prepare some special food for them which is good for their digestion? Are we giving them time? I'm again coming back to the same word, are we giving them time? Well, a lot of thoughts on this topic, friends. So geriatric health is not mere diagnosis and treatment of ailments. It also focuses on attention on risk factors, the physical risk factors, the social, rehab, psychological and environmental. Though everyone knows, all of us knows that one day he or she will get old, no one knows when does the aging process really start. The UN has given a cutoff age of 65 for a person to be considered elderly. The elderly population of the world is not homogeneous, because individuals age at different speed and deterioration rate is also different. So there can be difference between the chronological age and the biological age. But one profession if you be, you will never age, which is politics. You will keep on ripening and ripening. So if we don't want to be really get into aging, Omkar, I think we should all enter politics. So we ripen and keep on becoming young and young with age. Yes, sir? Oh, lots of them, sir. So friends, look at this man. He must be in his 90s, above the octogenarian, but he's still smiling. Look at his eyes, so expressive, so full of emotions. You'll agree, sir? But with age, what happens is that your entire system starts working at the ebb. Your eyes can't see properly. Your nose cannot smell nice samosas being fried in the kitchen. Your feet cannot walk even this small distance which used to run in just a few seconds. Your stomach cannot take that Delhi Darbar biryani which used to relish upon all the time. You cannot probably do the namaz the way you used to do before. You can't go to the temples. You can't even lift your hands to, strike the bell and to wish God properly, because everything is aching and paining. We have come here to enjoy, friends, and we all are going to go through this. All these people are still young. We are slightly younger, but we are all going to go through this phase. So today's lecture is about enjoying this phase also, and how can we give better healthcare to these people who need it. There's one nice song. Have you heard this song? These are the few of my favorite things. La 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 la. Let's see this, listen to this parody. What exactly happens to in old age? Okay. Maglocks and nose drops and needles for knitting, walkers and handrails and new dental fittings, bundles of magazine tied up in string. These are the few of my favorite things. Cadillacs and cataracts and hearing aids and glasses, Polydentons, Fixodents and false teeth in glasses, pacemakers, golf carts and porches with swings. These are the few of my favorite things. When the pipes leak, when the bones creak, when the knees go bad, I simply remember my favorite things, and then I don't feel so bad. Hot cups and crumpets and corn pans for bunions, no spicy hot food or food cooked with onions, bathrobes and heat pads and hot meals they bring. These are the few of my favorite things. Back pains and confused brains and no fear of spinning, thin bones and fractures and hair that is thinning. And we won't mention our short shrunken frames when we remember our favorite things. And when the bones ache, when the hips break, when the eyes go dim, then I remember the great life I had, and then I don't feel so bad. It's a good one. Yeah, I have to. So I think this summarizes what happens in the old age. These things are bound to happen. Gentlemen, these are not diseases. They are a path and a process of aging. But we can definitely, with the help of good medicines, whatever they may be, Ayurveda, homeopathy, modern medicine, yoga, music therapy, whatever, or just plain nice counseling, these things do help, and they'll help these our elderly gentlemen to feel better. Let us see what my homeopathy can offer in these complaints. Today also we are going to just touch the common things. I don't believe in the rare things, sir, because I always tell my students is that the common manifestations of rare things, rare syndromes, are much rare than the rare manifestations of the common things. Okay, so let me talk today just about the common illnesses which affect 90 to 95% of the population. 5%, if you have any questions, we can always talk offline or in the discussions subsequently. CNS, psychiatric, respiratory, cardiac, MS, cell system, GI, skin and urinary system. So what are these symptoms which affect the the system of the brain? So basically I would like to call all these as geriatric giants, which are immobility, instability, incontinence, impairment of intellect and impairment of the memory. Now the basis of treatment in homeopathy is a good case taking. We cannot tell you, sir, that ऐसा हुआ है ये दवाई ले लो. The basis of homeopathic treatment is a good history. Omkar knows we take history at least for an hour as students in homeopathy, and later on also we take sometimes 2 hours, because we need to know about a person's habits, about his nature, about his sleep, about his food habits. Everything is taken into account, and we select a remedy which is so called the constitutional remedy. But whenever a person becomes immobile, in the sense he develops something called as bradykinesia, he cannot get up, one must first think that is it Parkinson's disease? One must investigate thoroughly. But again, you know, before starting the drugs, one must understand that are drugs necessary sometimes, and will they help in the long term? And in these cases, our nice drugs like Merck Sol or the snake group drugs which are good for Parkinson's disease, they are helpful in a big way, whereby the patient feels better and definitely his mobility improves. Instability. Again, instability means that a person either has developed some gait ataxia, some cerebellar lesion. Okay, so these should be investigated neurologically, and then appropriate drug like maybe like gelsemium Okay, maybe like belladonna or glonoine, all these drugs come in picture where we administer. Whenever an elderly adult comes incontinence, one must think first of all that is it something called as normal pressure hydrocephalus. This is very common, people miss it and then we start investigating. In NPH, normal pressure hydrocephalus, the person comes with a gait apraxia. He does this way, plus incontinence, plus memory loss. Okay, it's a trio of great apraxia, memory loss and incontinence. I remember my teacher Dr. Nitin Sampath teaching me this and seeing patients of NPH with him. So one doctor must know what is he treating and then the treatment follows very easily. Impaired intellect and impaired memory. Friends, all these fall in a sort of common condition of the old ages called as Alzheimer's disease, where memory, intellect, affect, all these are into consideration. A simple Alzheimer's, what happens? He starts forgetting the names. Then he starts forgetting major events, minor events. His past memory is very good, but recent memory he just keeps on forgetting. A typical case, a grandchild or a son goes to the market and says that, "Ai, mi dato hai, hi chavi ahe, chavi de ikde," and she forgets. And then the son scolds the mom. "Kai kalat nahi evda ka tula." So friends, I make an appeal to all of you and all these gentlemen who are going to see the video also. Please try to understand the elderly people. Don't scold at them. It is not correct because they are not doing it out of purpose. They genuinely are forgetting things. And today, the extent of Alzheimer's is increasing in a big way because Alzheimer's disease has become so common. If you see here, these lights may not allow, the healthy brain and the severe Alzheimer's brain, you will see enlarged ventricles, you will see the shrinkage of hippocampus, okay, you will see severe cortical shrinkage. Cortical shrinkage means that the memory area becomes slightly less. Then you tell me, how can a person think in such places? Okay, they'll know, अरे आप कैसे आप मिले हैं? Then you will ask, ओळखलंस का? And they may not be able to identify their own nephew whom they have met after 2 or 3 years. Taking time to remember, and it's a gradual process of decline. But now I'm trying to say is that catching the patients of Alzheimer's early is very important. And after you catch Alzheimer's patients early, you have to go to a nice protocol where, multiple people are involved. A neurophysician is at the center of the helm of the affairs. We homeopaths also have nice drugs like anacardium. I'm giving so frequently anacardium, I'll repeat here, which also helps in the cause.